Thank you so much, Pastor Young, and I'm very honored to join the group today for a conversation. So my name is Gloria Reeves. Please call me Gloria. I'm a physician and a psychiatrist over at University of Maryland. So I'm actually zooming in from Baltimore. So Baltimore, if you don't know, we call ourselves Charm City. And we're known for our crab cakes and our love of sports teams, the Ravens, the Orioles. But our barbecue is not as good as what I've had in Memphis before. I know that for sure. But we are here because it's a small world right now. We're all dealing with the same situation, and we're just here to put our heads together and learn from each other today. So I'm really deeply honored for the opportunity to come and present. So I'm just going to talk for about 10 minutes just to kind of introduce and give the lay of the land of how we're thinking about this presentation today, and so to set the expectations of what we're hoping to folks will get out of it. So let me share my screen. Okay, all right. And everyone can see my screen okay? Can I get a thumbs up? Yeah, okay. So in presenting today, as a physician, I spend a lot of time talking to people about choices for health treatment. And I wanted to just set the stage that our goal today is not to convince anybody to make any specific types of decisions. What we really want to do is make sure that you have the information you need and the support you need to address barriers to even making a decision, as well as to follow through on it. So we're here to learn from each other, to share information, and to really support health decision making. So we have a lot of respect that people make decisions that are based on the best interest of themselves and their family members. But we also, as parents, we want to model for our children that we want to get good information from accurate sources to be able to make decisions that are in our best interests. So my piece of the talk, so I'm the only MD on the group who doesn't have a background in internal medicine, probably in intensive care and those sort of things. My background is in mental health. And the reason that's relevant to talk about today is we're all going through experience of anxiety, worries, challenges as a nation. And so I want to just share a little bit of information about how that might be impacting your decision-making process, and just some things to consider in how to get out of that feeling stuck or feeling overwhelmed. The other panelists are going to be providing a lot of information, kind of vaccine 101. I know people have been hearing a lot of information about vaccines, but it keeps changing pretty rapidly. So we want to make sure you have the most updated information about vaccines in terms of pros and cons as you're making your decision. And then I think all of us on the panel have personal experiences with vaccine decision-making. We'd be happy to share during the Q&A and discussion. And we want to make sure that we address any practical barriers to completing a vaccine if you opt for that choice. So just to give you an idea of my bias, so my perspective, besides being from the Baltimore area, just some other things to be aware of. So I do clinical research related to medication side effect issues. So to me, it's safety issues are really important when making a decision, and so happy to encourage any questions about safety issues that you might have or things you've heard from family members, friends, neighbors. As I mentioned before, I am a mental health provider, and so I've had a lot of experience to talk with patients generally about their anxiety about making a decision about vaccination, but also I've had experience supporting families who have a family member with special mental health needs get through the vaccine process. And then the last thing, and this is probably the most important, I'm a parent of a teenager, a 17-year-old. I thought the pandemic was scary, but teaching her to drive was probably a little bit scarier than that. But I have a child who has a pretty bad fear of needles and shots. And so I'd be happy to share experience as a parent, what it's like to go through that process as well. Okay. I want to start out and just to highlight some information that probably things you know, but just to kind of reinforce what some of the challenges are with making decisions right now about health. And a big one is that we're all undergoing a lot of stress right now. So this is from a recent information from a recent study, and they highlighted nationally, these are the different types of stressors that people are experiencing related to the pandemic. And oftentimes people are experiencing multiple stressors on this list at the same time. So some of the general categories are, a lot of people are going through relationship stress. So when we think about, reflect on our own lives, our lives of family members, friends, neighbors, people are going through family relationship challenges, feeling isolated, loss of people who are close to them. There's been a lot of illness, death, dying. And we've really restricted ourselves a lot in the last 2 years from traveling, seeing people that we care about, people that we love. There's also a lot of stressors people are experiencing in the financial realm. So people have experienced missed time from work. Maybe they've had to quarantine because somebody's been ill, or losing a job because business is not going well, difficulty paying rent, difficulty with getting adequate food for the family. So financial stressors, those can really be at the forefront and really causing a lot of anxiety. And then lastly, for those of us on the call who are parents, every parent I know has been through challenges with childcare issues in school. So it's been a bit of an unpredictable year in parenting and thinking about how to raise our child. So when we undergo a lot of extra stressors, a lot of pressures, a lot of anxiety, it's important to keep in mind that there are positive aspects of anxiety and really negative aspects of anxiety. The negative aspects are that most people, when their stress goes up and their coping strategies go down. So there were a period of time we were told to not even hug people that we cared about outside of our immediate bubble of our family that we're living with. So when stress goes up and coping options go down, people tend to have one of two responses. So they tend to either have the kind of where they get frozen, where they shut down. And so they have trouble making decisions, pushing ahead, or they start feeling a lot of distress. And so those can be really harmful for our health and wellness, but also to make a decision, it's really hard to concentrate, to think things through in a way you typically would and get the support you need to make decisions. On the positive end of things, there's not much positive about going through a pandemic, but we do know that stressful situations help focus us around two things. So one is around safety. So we're much more aware and attentive to safety concerns, and that's important because that's going to keep ourselves and our loved ones safe. And it's also this anxiety we're going through because of the pandemic is often can be a motivator for action. So we want to try to balance out that feeling afraid, overwhelmed, and kind of shut down with kind of refocusing on how we can protect our families, encourage safety, and do the steps that we need to do to stay safe. So vaccine-related anxiety comes in a lot of forms. And I know that in the news, they use a lot of the term vaccine hesitant gets used a lot. I've been asking parents over the last month, is there a word you like better instead of vaccine hesitant? And I've heard a lot of options for that. Things like vaccine afraid, vaccine confused, vaccine worried. And so there are a lot of ways that anxiety can impact the decision-making process for vaccines. So first is, even being able to make a decision. So a lot of families that I speak with have a mistrust of vaccines generally. And if you have a child with special mental health needs, you might have worries that vaccines can make conditions that they have get worse, or you may have a general mistrust of health systems. How is this vaccine done so quickly and that sort of thing? So there may be mistrust of vaccines. Most people I talk to have difference of opinions from their trusted family members and friends. So it's hard to get a consensus from people that we normally turn to help make decisions. So making the decision is really difficult. And then if you decide to get the vaccine, then you have to deal with the issues that day, right? So dealing with missed time from work, any fears around getting a shot. So needle phobia is very common. It's been estimated up to 1 in 4 Americans have some degree of fear of getting shots because of fear of needles. So these are anxieties around the day of getting a vaccine. And then there's anxiety related to things in the future. So will the vaccine cause any long-term problems? Is it going to make me feel sick down the road? Am I going to miss time from work? So lots of different concerns. But just as a reminder, we know that when we are stuck in our decision-making process and we can't really make a determination either way, which way to go, we often as parents focus on the idea, well, I'm just going to delay. I'm just going to stop thinking about it for now, or I'm going to avoid making a decision, that sort of thing. So why is that a problem? So nationally, we know we have a problem not just about COVID vaccines, but childhood immunizations in general. So this very fancy graph, there's a lot of information on it, but the only thing you need to pay attention to are those blue lines that are going downhill. And that is when we had last spring around the pandemic shutdown, kids were not getting their routine immunizations. So this anxiety we're feeling, being shut down, overwhelmed, it doesn't just impact health decisions around the COVID vaccine, but it's also impacting families in following up with routine childhood immunizations. So that's why it's really our hope today is to really think of a process where you get the information you need and you can start to be proactive in making decisions and kind of breaking up that process if you would decide to get a vaccine into kind of smaller steps and smaller goals. So how to manage this anxiety around making health decisions? Well, first and foremost is we need to practice self-care. So as parents, we often tell parents that we work with, you can't pour from an empty cup, if you haven't heard that expression before. And that is, if you're feeling a lot of anxiety, reach out, because that anxiety might be getting to a point where it's causing a lot of distress. It's hard to push ahead with things you need to do. And it's hard to make decisions that you need to make for your family and for your well-being. So first and foremost, making sure that we're taking care of ourselves as the captain of the ship and our families. The second thing, which I think is very helpful for people, and I've been having a lot of discussions, and that is to focus your information sources. And by that, I mean, people are getting information from all different fronts, all different aspects of life about vaccines, on the news, on social media, from friends, family, from their doctors, from lots of different places. Narrow down those sources of information to folks who are trusted advisors and folks who can provide accurate, reputable information, because sometimes that information overload just incapacitates us further. The other thing is setting small goals. So if you're trying to think about something like a vaccine and consider it, maybe you need to start with just planning. How am I going to schedule it so I don't miss too much time from work? Maybe setting up an appointment with the doctor to get their opinions on the vaccine. So setting up small goals to get to the larger overall goal. And then figure out who your support team is. So if I lived in Memphis, I'm sure I'd be stopping by and visiting Pastor Young at least once a week, asking for support and help for challenges I'm going through. So think about who's on your support team to help you get through those small goals to get to your larger objective. Okay. So I'm going to stop sharing there. And just to say, congratulations, you've met step one, which is just coming to this program, getting information you need. But I want to encourage people to feel good about what you've done to get through this really challenging time, and that lets you know that anxiety has been a universal experience over the pandemic for all of us. So we want to support each other and help you be proactive in making decisions that you feel like are going to be in the best interest of you and your family. So I'm going to pause there, and I don't know if Michelle, if I should answer some questions first, or we're going to go through the talks first.
If you would, I think what we want to do now, we want to allow Dr. Deepak. So if you could introduce Dr. Deepak, I would appreciate it, and yes. Then we'll move on. So that's what we want to do. Thank you.
Okay. So we're shifting now from talking about just the general challenges with the decision-making process to now getting to that point where we're getting accurate, up-to-date information, what you need to make a decision. So I'm very pleased to turn over to my colleague at University of Maryland, Dr. Deepak, who's, if you're not feeling well, if you're sick, this is the kind of person you want to know, because she's trained in so many areas. And I would think of her generally as the term I would use, an intensivist. So when someone's really sick, Dr. Deepak gets called. So Dr. Deepak, thanks so much for presenting today.